Paying too much money to see a doctor, getting charged crazy amounts just for routine procedures, and trying to figure out exactly what is covered by your insurance? Why is the healthcare system in the US so broken? Most countries in the world have some form of universal healthcare, sometimes called single payer. Because everybody pays into it, everybody benefits from it. Sort of like public schools or public transportation.
Basically, you take away private insurers and the government runs the insurance program. And so the government is the single payer.
In the US, the idea of universal healthcare has always been a non-starter, especially on the federal level, but it's quickly picking up steam among young Americans. A recent poll showed 45% of people between 18 and 29 support single payer, and 66% of young Democrats.
More and more people are realizing that we can't stay on this trajectory. The millennial generation is the highest level of uninsured in the country. Not only do we not have access to employer plans on an increasing level, we also don't have the money that our parents' generation had in terms of real wage growth.
As enthusiasm around the idea continues to grow, some states aren't waiting for Congress. But when New York, California, and Vermont tried to enact their own versions of universal healthcare in the last few years, their efforts failed. But there's one state where some think it just might work: Maryland. And there's one candidate for governor who's betting on it.
If we want to unlock opportunity in our state, we've got to fix the healthcare system. There's no state that's ever been in a better position than us to make single payer happen.
Why might Maryland be different? Well, most notably, the state tends to be left-leaning, with twice as many registered Democrats as Republicans. Maryland also has the highest median income in the US, which means more people with money who can pay into the system.
Canada started with one province standing up and saying that we will do it. Maryland can be that state here. We have the will. We've already shown that if you move in this direction, we can save hundreds of millions of dollars.
Ben Jealous isn't alone in embracing single payer for his election campaign. Gubernatorial candidates in Iowa, California, Massachusetts, and Michigan, among others, are all running on a Medicare for All type platform. Why is this gaining traction?
Because of the pain in our society. And we've hit a place where our healthcare has become so expensive and is exerting so much pressure, not just on working families, but on small businesses, that something's got to give.
But single payer advocates aren't so sure this could actually happen in Maryland, or that trying to solve this on the state level is necessarily even the right approach.
You can really only do it at the national level because there's so many national laws and policies that get in the way that even if you passed a bill that looked something like single payer, you would then find yourself trying to get waivers from the federal government.
Until recently, campaigning on a single-payer healthcare platform might have been political suicide, but things are changing. Bernie Sanders' Medicare for All plan last year garnered 15 Senate co-sponsors, including some potential presidential contenders. Just 2 years earlier, he couldn't even find one.
I think it's notable that every Democrat who wants to be president, who's in the US Senate, has signed on to Bernie Sanders' bill.
There's a big battle that's going to be played out in the Democratic Party over healthcare. The country has been activated. I mean, we all watched what happened when Trump tried to get rid of the Affordable Care Act, and there were thousands of people down in Washington, some people sitting in. You saw disabled people being carried out of the Senate and the House buildings.
We're working just as hard, and in some cases harder for longer hours, but we're getting less. We see that money is being generated in this country. It's just going into the pockets of the super wealthy.